Talking health, vaccines are only as effective as the systems delivering them. And in Osun State, where many communities once faced long, uncertain journeys to the nearest clinic, a growing network of revitalized primary healthcare centers in changing the narrative. Olalekan Akindoju reports that with solar-powered facilities, better drug supply, and a closer link between antenatal care and child immunization, the state is seeing real results.
Oluwaseyi Omoni cuddles a 15-month-old child as she presents him at the primary healthcare center in Osun, a town in Irekpodun local government of Osun State, for another dose of vaccine.
It's easy for me because my house is nearby. It's not far from this place. I will not take any Okada or bus to come here because it's at the back of my house. That is why it's very easy for me and every one of us here.
Across Osun State, more families are being connected to the primary healthcare system, and mothers are bringing their children for vaccination through a link with other essential services like antenatal care and screening. Through an integrated vaccination campaign, eligible children, pregnant women, and other residents of the state are also benefiting from integrated health services. In the past 2 years, the government says it has completed the upgrade and renovation of over 200 primary healthcare facilities across the state, each one situated in a ward, thereby bringing healthcare closer to rural areas and helping to expand vaccination. The revitalized health centers were equipped with solar panels to ensure 24 hours water and power supply, as well as provision of drugs through the Osun Primary Healthcare Board. It's a Wednesday morning in Osun, Egbedore local government of Osun State, and the PHC in the town is filled with children and young people who have come for vaccination. Tomilola Adebayo has come to take the human papillomavirus HPV vaccine aimed at preventing cervical cancer. She says the process has been made easier by the availability of a functional PHC in the town. Success Oyelowo also brought a 3-month-old baby to the PHC for routine immunization.
Every child has this particular card called immunization card. A date is being written, given to every parent, which indicates the date a particular child is to take that immunization.
According to the World Health Organization, WHO, immunization currently prevents 3.5 million to 5 million deaths every year from diseases like diphtheria, tetanus, whooping cough, influenza, and measles. Findings suggest that Osun State has a low zero-dose prevalence compared to many other states. And according to the Nigeria Demographic and Health Survey, NDHS, in 2018, 17.2% of children aged 12 to 23 months were fully vaccinated according to the national schedule. This rate jumped to 41.2% in the 2023-2024 NDHS survey, showing a 24% increase. However, this still falls short of the WHO's 80% target.
In the time past, it's lagging somehow because people are not getting to have the understanding.
Head of the Nigerian Red Cross in Osun State, Tolulope Ogunleye, believes the state government investment in primary healthcare centers has made it easier for residents to have access to vaccines.
If you have vaccines at our cold chain co-room and there's no health center to take them to, how will our people be beneficiary of these vaccinations? So that's why I said, linking it together, we have vaccination, availability of vaccines, then we have healthcare centers to take them to. So that brings the connectivity. On the 12th of December 2024, Osun State emerged as the Southwest champion of the Primary Healthcare Leadership Challenge Award with a prize of $500,000, an amount expected to be further invested in the PHCs. Across several towns in Osun State, many residents seem to now have access to vaccination. This is due to the expansion of the primary healthcare system across the wards of the state. However, some issues still remain. Osun State has 332 wards, and the government's claim of renovating and revitalizing 200 PHCs means there are 132 wards yet to be reached, though the state governor, Ademola Adeleke, earlier promised to ensure the rest were completed in 2025. Fatima Raimi is a resident of Egbedi Town, Egbedore local government area of Osun State. The aged woman who stood in front of the community's dilapidated health center wants the state government to extend its PHC renovation drive to the town.
While access to vaccination has improved in Osun State, Fatima's concerns are important as the renovation of 200 out of 332 PHCs means some communities still have limited access. Rural and hard-to-reach areas still lack functional centers, leaving gaps in equitable service delivery. There are also issues around staff availability, medical equipment, drug supplies, cold chain facilities, and some other essential services. The state government must also put up a sustainable plan to ensure the renovations and upgrades are maintained in the long term, most likely through budget provisions. Tolulope Ogunleye, who heads the Nigerian Red Cross in Osun State, also says there are other challenges.
When you get to some houses, to orientate them, to sensitize them about particular disease, they say, I know in our church, in our mosque, they say we should not take such. That is one. Two is cultural belief. Some say in our own lineage, it is Agbo we take.
Olalekan Akindoju, Western Spring Television News.